Hi everyone. Fix this. Hi everyone. Have you ever known somebody that's a foot tapper, or a leg bouncer, especially? Ba, 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 ba. They don't really even know they're doing it. This is kind of a dangerous thing, not in and of itself, but what it represents. So, really, there's been a sea change in medicine in the last 15, 20 years. There's this massive understanding now that many of the common diseases that we are faced with are due to inflammation. Like 85% of cancer, all right? Colon cancer, breast cancer, most brain cancer, lung cancer, it won't happen unless the patient has a state of chronic inflammation in them. Like breast cancer, super rare before 1900. Why? People that didn't have chronic inflammation. Okay. Heart disease, strokes, autoimmune disorders are triggered by inflammation. Diabetes is triggered and driven by inflammation. It's a huge factor. Okay. It's just the unfortunate thing is the way our healthcare works in America is there isn't much attention put on it unless a drug developed by a pharmaceutical company can make a couple $1 billion a year. Okay, and but there's a lot you can do. Now, chronic inflammation, as I've talked about in many other areas, prevents your brain from recovering from minor injuries. Okay, now probably the most common symptom that people have of the brain injury, I'm talking about minor brain injuries, where you snap some neurons in your brain, but you don't bleed, okay? These are hitting your head on the hatch of the car, to a concussion. These are emotional traumas. These are inflammatory traumas, like COVID does this to people. And the most common thing that happens is people can't generate the proper flow of blood into their brain, okay? And if you don't have enough blood in your brain, the oxygen, so you have red blood cells carry oxygen, you breathe, you fill them up, you got to push it up at the right pressure for the oxygen to flow into the brain. If you don't have the right pressure, you don't get all the oxygen releasing, the brain doesn't get enough oxygen, and it doesn't function well. This is ADD, all right? ADD is called cerebral hypoperfusion, brain low pressure, and these drugs like Adderall, Ritalin, and stuff we use, the primary thing they do is they push blood in your brain. They increase the pressure of the brain so the oxygen flows into the brain, okay? Super common problem, right? Now, if you don't have enough pressure in your brain, what happens is the blood pools in your legs. And your brain doesn't like this lack of oxygen. Your brain will figure out, hey, if I can get my person to wiggle their legs, it increases pressure, increases oxygen delivery to the brain, and the brain feels better. So when you're going da 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 all the time with your foot, or you're doing tap 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 with your leg, you had a brain injury and you did not recover from it. If everything works right, and you get one of these injuries, you should fully recover in a few weeks to a few months. And if this has been going on for a while, you have a brain injury you didn't recover from. And the primary thing that prevents that from happening is inflammation. So you need to deal with the inflammation. If you're a foot tapper or a knee bouncer, and this is from inflammation, it may not seem like a big deal to you, but this is the inflammation that's triggering diabetes in your friends, or breast cancer in your sister, or caused your dad to have a heart attack and die at 55. Okay, it's the same thing. So if you're foot tapping, you got inflammation, and the clock is ticking for something bad to happen. In the 1980s, super rare to see somebody under 60 with type 2 diabetes. Now it's routine in 30s or 40s. Why? Inflammation starting much sooner. Colon cancer, triggered by inflammation, is starting so much sooner now, they're starting to screen people down instead of at 50, at 40. We're in an epidemic of lung cancer in 40-year-old non-smoking women because the inflammation's so bad. It's bad. It's killing people. Life expectancy of white males in America have dropped 5 years in a row. This started before COVID. This is not a COVID thing. So that bouncing you got a warning. You've got too much inflammation in your body's not functioning right. And you better start doing something about it now. Now, there may be other approaches that come along. I've been lucky I was able to put together where high doses of DHA every day, that's an omega-3, olive oil every day protects you from inflammation in the food supply, rifaximin as an adult to help balance your gut bacteria, and most people need a vagus nerve stimulator to help your natural inflammatory control mechanism to work better. Okay? This isn't about just some nuisance of tapping your foot or something that's occasionally embarrassing because you bounce and the table shakes. This is about a sign of a disease process that will probably prevent you from living a fairly normal lifespan. I hate to be so dire, but it's that bad. It is really that bad. So start focusing on inflammation. Do everything you can. That should be your mantra. That should be your obsession. I guarantee you do that, a lot of things are not going to happen to you. You'll be healthiest one amongst all your friends. All right. Good luck to you all. Hang in there.